I am 58 years old, female, with under-eye puffy bags. Do you think Juvederm would be the best route for me?
Thank you for your question. You're 58 years old, you've submitted 2 photos, and you've described yourself as having puffy under-eye bags, and you're asking if Juvederm will be of any benefit for you to help you with the under-eye bags. Well, I could certainly help you with this question. I'm a board-certified cosmetic surgeon and a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. I specialize in cosmetic surgery of the eyes and the face, and certainly I can give you a lot of about my experience with dealing with puffy under-eye bags. Now, it was a time before the hyaluronic acid fillers came out where anybody with puffy under-eye bags really only had one choice, which was to have some type of surgical procedure. Once the hyaluronic acid fillers came out, it became clear that there was an option for people with a certain degree of puffiness under the eyes. Now move the clock forward, and at this time, there are too many people who have significant puffy under-eye bags who are being made excessively puffy from getting Juvederm or other fillers. Let me explain this. Essentially, the issue you're dealing with these puffy bags is called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat pockets that are normally around your eyes pushes forward and creates a hernia. We actually refer to this as herniated fat. As such, it is a certain volume and it is pushed forward. So the concept of fillers is to add volume in transition zones between the fat pocket and the rest of the area. So we often refer to that as the valley or the tear trough, as well as adding volume into the cheek. Now, what sounds like a theoretically good idea can sometimes be quite undesirable when you actually execute the procedure. And the reason is what happens is you get a lot of material, and all these people look very often very swollen, very puffy. Ironically, they're addressing puffiness. So it would be, and I would explain this to you as if someone like yourself came to our office. What I would recommend for someone like yourself is a lower eyelid blepharoplasty. Now, if the fear of surgery is what is holding you back from meeting with cosmetic surgeons, I can certainly share with you what we've done over the past 20 years in our practice and has been very successful. The issues with cosmetic surgery when people are afraid of and why they embrace or try to avoid the knife is they don't want to have anesthesia, like general anesthesia. They're afraid of the risk of complications. They're afraid of the potential problems related to complications of surgery. They're afraid of issues that are related to the downtime and the convenience. So when people come to us, one of the first things they like is that my training was first in eye surgery before I trained in cosmetic surgery. And cosmetic surgery is a specialty separate from plastic surgery. It is its own unique board, and it's a specialty dedicated to cosmetic surgery. That's one part of my training. And then the core part that was after my training in eye surgery was oculoplastic surgery. That means surgery focused on cosmetic surgery of the eyes. So when their fear of complications and issues is there, they feel more comfortable coming to a specialist who has extensive training and experience with eyes. So that's one thing that makes people feel better. The other things that also are helpful is that we do our procedure in our office within our own Joint Commission approved facility. This means where essentially we have duplicated the safety and methods of ensuring quality that's used in hospitals and surgery centers, but in a doctor's office outpatient surgery type of facility or office-based surgery facility. And then last but not least is we do everything under local anesthesia with light sedation. That means you don't go under general anesthesia, you're not paralyzed, you're given just enough sedation so you're comfortable. It helps the time go by quickly and you wake up without having any of the side effects of general anesthesia. There are many patients who have come here who have had fear about their under-eye bag surgery. Once they had it done, they've said to me that if they knew it was that easy, they would have done it sooner. So I think that would be my recommendation, is that you would have a procedure, and I think that even though I haven't examined you based on your skin type, it is routine for us to do this procedure called a transconjunctival blepharoplasty. That means that the procedure is done from the inside of the eyelid without any external scar. A lot of people with darker skin are very concerned about what they commonly refer to as keloid scars, or hypertrophic or thickened scars, or undesirable scars in the outside because of experiences they've had in other areas of their body. So by doing it from the inside, it actually avoids that issue altogether. I actually wrote an article years ago called Ethnic Considerations in Eyelid Surgery, and I have extensive experience with all ethnic skin types, so certainly I've recognized that concern for anybody who is darker than, let's say, Mediterranean or olive skin complexion. So I think it's important that you meet with experienced cosmetic surgeons who specialize in eyes, which is, of course, my bias, because of the way I feel the optimal experience is. And when physicians look for other physicians to take care of their concerns, they often look for specialists. So it's not exactly out of the norm that as doctors we try to find the most experienced and the most specialized people to take care of ourselves and our own families. So the same should apply for everyone. It's basically the golden rule. I think that once you meet with a doctor you're comfortable with, you see the results, you see the before and afters, you see how the aesthetics of that doctor is, you'll find that the surgery will most likely be much more satisfactory to you than having a filler. Now, some people will still experiment and try the filler, and of course it's a relatively low risk experience. There's a little bit of expense and of course the procedure, but I think with the degree of fat prolapse you have, it's best that you actually approach the fat pockets more definitively rather than trying to hide them with fillers. So I hope that was helpful. I wish you the best of luck. Thank you for your question.